over 10 years ago, there were two groups meeting. One was a group of senior, probably clinical psychologists, and one was a group of people who worked within what was improving access to psychological therapies and is now NHS Talking Therapies. But there was no joining up. Well, we need to do something. We need a bigger voice, at which point the room of about 20 odd people turned to me and said, "So what are you going to do about it, Geeta?" And I was like, Claire and I started working together. We spent quite a lot of time thinking about what the network should be like, what was important to us, and I think that was key in terms of getting the aims of the network, that this was for all psychological professions. One thing we'd all definitely agree on is improving access, good services, better psychological well-being for the people of the northwest of England.
We've started to develop a fellowship scheme so that we can bring leaders on through the ranks early in the careers, and to think about what are the core transferable skills that the psychological professions have to add to that workforce planning and education commissioning conversation. Our multi-professional collaboration, bringing psychological approaches to other parts of health and care. We've struck up those conversations and have really developed some innovative pieces of work with them over the past few years. We've been really pleased with the way that we've been able to support and encourage Experts by Experience to develop a regional steering group, and we really hope that that can provide a platform for a bigger input for Experts by Experience, people with lived experience, into the future of education, commissioning and workforce planning and development for the psychological professions across the board.
The North West Psychological Professions Network has taken a number of different approaches to leadership over the last few years. So that's included access to leadership development training for our members, and also more recently the development of the leadership fellows within the network. I've always been really proud of our multidisciplinary approach within the network. Our community of practice are very much about us listening to and supporting our membership, and very much enabling them to lead the work themselves.
And I think we've really achieved some very positive steps towards that, with the appointment of the National Clinical Lead for the Psychological Professions and a PPN in every region.
Recognising that the Psychological Professions Network is now over 10 years old, it pays tribute to the fact that we're bringing in the mental health workforce community into our wider planning for health and care workforce solutions. Without the PPN, that glue wouldn't be there, and so that wouldn't allow us to develop in the areas we want to develop, grow the workforce we wanted to grow, support the individuals to do what they want to do. So it's hard to imagine it without the professional network, but there's still much more to do.
It's really helped to actually bring together that multi-professional offer in psychological professions. It's helped to develop new roles within psychological professions and really tackle some of the intensely difficult areas of workforce planning. And it has joined us together with the North West Strategic Workforce Planners to be able to develop a workforce that's fit for purpose for the future. For the people who are the members of the PPN, I think it offers great opportunities for training, for networking, for development, and also working with planners around workforce for developing new roles again that we probably even haven't thought of yet within the next 10 years, because we've progressed so quickly over this last 10 years.
The PPN has kind of shown a great willingness to embrace and bring together existing and new professional groups. And I think going forward, as we see an expansion of entry routes and different professional groups delivering psychological care, PPN is the right home for bringing those professionals together under one organisational network.
The PPN have really supported innovation in health psychology. A really good example is for the first time last year, we had some funded places from Health Education England, and the PPN have been really influential in us, again, talking to the right people, being considered by the right people, and that undoubtedly helped us to get those funded places, which we're very much hoping will continue into the future.
Working with the PPN has led to two particular innovations to support our GP trainees. The first has been posts based in a combination of general practice and IAPT. The other innovation has been a placement planning tool. All the pilots and the initial work with the PPN have been so successful that we're very keen to build on this in the future.
The PPN is important because because it brings together a conversation space between professionals and service users and carers. Experts by experience are crucial in a better understanding of a nuanced, empathetic, caring mental health system.
The fellowship has enabled me to secure a role as workforce lead for the psychological professions in Lancashire and South Cumbria, and without the fellowship that wouldn't have been possible. It would be really great if these can continue to allow other people to have the opportunity to be immersed in the strategic environment, to develop these professional and strategic leadership skills.
I really enjoyed working with the PPN on the placement. I gained some kind of systemic knowledge and understanding about how NHS systems and NHS leadership works. The PPN has made a difference to me and my professional career by enabling me to have some opportunities that I don't think I would have had otherwise.
The placement has benefited me because it's really helped me to think about my leadership skills, which is one of the core competencies of being a clinical psychologist. None of my placements so far have been able to offer me as much opportunity to develop these skills in leadership as they have with the PPN.
I was really lucky that I worked with two amazing female leaders, and I think it's really nice to be involved in something where you can see yourself represented, both at this particular moment and also future you. It means that they can invite and support voices who have different experiences, different values, different knowledge, and can offer different types of leadership. So they really kind of inviting other voices in so that we can work effectively for different communities.
We were noticing these massive gaps, and counsellors who were funding their own training were extremely unhappy because the training costs them a lot of money, and once they'd trained and got their qualifications, there weren't any jobs because of this poor sort of commissioning around counselling. So sitting at the table with other professionals through having been part of the PPN gave me that wonderful opportunity to air these challenges, talk about them. So if PPN had never been formed, nothing would have changed for counselling, because you need loud, important voices at the table to be able to talk to NHE senior leaders.
The impact of the support of the PPN in our community of practice is that it's helped to organise us in a way, it's helped to facilitate the coming together in real rooms and virtual rooms of our CPPOs across the region, and it's enabled us to be focused and get some of that admin, organisational and project management support that the PPN can bring to projects like this.
The impact of collaboration with the North West PPN has been really, really positive. The development of our own community of practice for low intensity practitioners, and the membership of that is growing with different groups for adult PWPs, CWPs and education and mental health practitioners. And we've run a series of online conferences for talking therapies managers and clinicians with anywhere up to 100 attendees at each, and I sincerely hope that that's something that we're going to be able to continue to collaborate on in the future.
The PPN has been so helpful in supporting the BPS Careers team in developing our strategy, and we use a lot of the skills and the knowledge from PPN staff to help to feed into the work that we're doing. They've helped us to navigate the psychological professions, understand exactly what they are and how we can advise our audiences in how that they can actually access those different training pathways.
The PPN has been crucial to promoting the role of the assistant practitioners, developing that communication, understanding the apprenticeship route in and how that provides access to mental health careers going forward. PPN clinical fellows have been involved in the training scoping demand, which has been hugely helpful, having that psychologically informed lens on the demand scoping, and we will continue that with subsequent rounds.
Having the PPN embedded in NHS England has been invaluable. It's given an opportunity for two-way communication between the network members and the mental health team. It's enabled us to get information out to the system about our training opportunities and the development of new roles.
I'd love the Psychological Professions Network to to continue. I think some of the things we've worked on are around increasing diversity in the professions and also improving career and leadership opportunities for the whole range of the psychological professions, and I want to see more of that. I want to see more opportunities for some of the newer roles to come in and actually develop and perhaps grow and lead some of the PPN activities or chair some of the regional networks.
It's a marathon, not a sprint, and I think that the development of leadership and us thinking about how the psychological professions can have leadership and workforce development very much embedded in their thinking and core training very early on.
With the changing structures in the NHS, so currently integrated care systems and boards, it's really important that psychological professions are part of those developments and are informing local service delivery and development. I'm really excited about the next stages of the PPN, especially now we're part of a wider network of PPNs across the country. It allows us to really build on our early successes and really continue to champion the psychological professions.
People really do want to work together, and we've managed to do it. And it does feel like a collective effort, but I feel really proud to kind of be part of that. The recognition we've got 7 regional psychological professions networks has just been great, and I just feel really, fortunate to be part of that and to have helped and supported those networks to come into being.
In the Northwest we started the PPN and it's grown and grown and grown, and now we are where we are. A whole plethora of professional groups across the whole of England and within the NHS and further afield.
We're asking people to make a PPN pledge for the next 10 years. Ours is to continue to build the leadership in the psychological professions and strengthen the voice across health and care. What's yours going to be?